Let us go ahead. Uh, what should be the psychotherapeutic management? So this is done to help the patient, so provide supportive care, strengthen the patient's self-esteem, because during that period, because of its behavioral and all these things, people, they do not go too close, and they rather try to tease, and therefore there is a great decrease in the self-esteem. So try to strengthen the patient's self-esteem. Treat patients as adult, because even adults are not behaving as adult. That is a problem in psychotic diseases. Prevent failure and embarrassments as far as possible. Yes, connection was lost. Okay.
Yes, sir.
Okay, okay. Now it is okay, na? It is going on, continue. Okay, fine. So then prevent their failures, embarrassment, because if is there any failure, maybe some game like thing is there, and then somebody beats them, then that causes that failure makes a big pain, that causes big pain in their thinking, or there is embarrassment to them. So try to avoid this embarrassment. See, they should be made or kept happy as far as possible. Basically, this is the situation. Respect their individuality, respect they are unique comparatively, but slowly, without being rude, without being very what we can say, sarcastic, or without any kind of any artificialness. They should be try to show the reality to them slowly. Okay, that means they should realize that yes, there is a problem and they have to overcome. Then in that case they can do it better way. But if they are just treated in different way, in negative way, they are avoided, they are scolded, they are not behaved properly, then their problem will be increasing. Then handle hostility calmly and matter of factly, that why there is hostility and can it be reduced, like that. So if this can be done, then there can be great improvement in that. So we call it as a behavioral therapy. So these all are various behavioral therapies. So what are various issues which are related to schizophrenia? First is family and the patients. There must be communication into that. There should not be much overprotection. Rather, there should be protection, but not overprotection. Blaming, etc. It should not be there. Then another problem which occurs is a non-compliance with the medical regimen, which should be avoided, because always medical regimen has to be complied with, and if it is not complied, then we can see that there are many problems, that the treatment will not be effective, or there can be relapses, or we may need to treatment which was otherwise very good in other patients. So these all things are to be kept in mind, and therefore non-compliances should be avoided as far as possible. Then caregivers' needs, that has to be checked. Cope with the strange and frightening behaviors like apathy, poor personal hygiene, violence. So caregiver has its own problem, because caregivers are like male nurses or female nurses, whatsoever there, the person is strange, then the behavior are frightening, because the behavior is very, very absurd in nature, and there is apathy, poor personal hygienes, they can be violent. So in that condition, caregivers needs has to be addressed, or some efforts has to be made, so that there can be reduction in the violence, it can be improvement in the personal hygiene, and the patient, the person is behaving in better way. Then other issues which are related to schizophrenia are depression, because depression are actually part of the symptoms of the schizophrenia. Many times they are masked during acute stage, means even though person is looking as it is in a what we can say very active one or hostile stage, it is maybe attacking somebody, but maybe somewhere deep in the mind the person is having strong depression. And in that cases it is masked during the acute stages. It is masked means depression signs may not be visible. People may pay attention toward these hostilities or to the aggressions, but deep inside there is a depression, and that has to be checked. The relapse can be there. Any stresses, I told you, if any points are there which are causing teasing to the person, or that is affecting, that is causing pain, that is causing any kind of anger. So these are the stresses should be avoided. Otherwise, the patient who is giving good response to the treatment, there can be relapse if these stressors are coming in between, and if there is a non-compliance to the various direction, including treatment. So that has to be there. There can be stress, and there should be a way to cope it. The treatment or this CBT, cognitive behavioral therapy, should help in understanding stress and coping with the stress. That should be helping more in patients. Then the biggest problem can be there, that is of substance abuse, because there are many substance abuse substances are there. Many of them can get habit somehow. I know some of the persons who had some mild to moderate psychiatric diseases, but they were alcoholic, and it led to very catastrophic problem. I came to know about very ill fatalities with these people because of the alcohol. So like that. So 30% have a liver problem, and it can affect treatment. It reduces the outcomes, or it makes the prognosis worsen. So these are the problems which are associated with this. Then next is work or no work, inability, no motivation. These are there. So as far as possible, maybe even if they are confined to work or home, they should be assigned some work, or if some work can be assigned, that can be better, that can be very good for them. Then depression and suicides in schizophrenia. As I told you, depression is a natural part of schizophrenia. Sometimes it is visible, or many times it is not visible. Depression can be masked, particularly during the acute phase, or as I told you, that is, we call it as a agitation phase or maniac phase, or we can say the person is acting that is in anger. So in that case, or hostility, as we have used the word. So in that cases, it is a problem. Depression is a reaction to the schizophrenia, because there is a changes in the neurotransmitter level, ups and downs are there. So these ups and downs can be, these waves can be very uncertain, and then therefore it should be taken care of. Then delusion and interventions, presenting reality, then they should be oriented point to point, person and place. The argument should be avoided. Then touch, competitive activities should be there. There should be reinforcement in the positive behaviors. Encourage the verbalization. Verbalization means give words to that. The patient should not be becoming too silent also. And if it is too much verbalization also, it should be somehow managed, somehow it should be asked to reduce, because sometimes it goes up and it can increase complications. Now disruptive behaviors, some limit should be set, because how much disruptive or hostile behavior one can tolerate. Maybe family members may tolerate up to certain extent till it is not harmful to them, but what happens, what about society, what others should think about, why others should tolerate particularly this unruly behavior. So in that cases, that limit should be set. Family members, without informing the patient that this is a limit we have set, we cannot say like that, but we should understand that what limit one can set, and once that limit is set, if it goes beyond, then immediately person should be hospitalized, where the suitable tranquilizers, suitable treatment. You might have seen people are tied with the chains, iron chains, and they are confined to rooms, isolated rooms like that. So this type of things are that can be done. That is, when limits are crossed, then go for like these activities. Decrease the environmental stimulus if possible. If it is understood, it is found, or one can have the causal relationship, that when this kind of environment is there, then again efforts should be made to decrease this environmental stimuli. Intervention before acting out, there should be some intervention should be given, some medications, some tranquilizers should be given before acting out. Observation should be closer one, check it out what are the impacts of various drugs or various treatments, particularly family member or those who are the doctors, they can do it, so that this will help in understanding the course of action, whether there is a benefit from the treatment and all or not. If not, then we can try for alterations into it. So the close observation is very, very important. It is a key actually in the prognosis. If safety environment is there, minimize the potential weapons. Nothing should be kept near this patient which can be very dangerous or harmful. Making contact with the clients, particularly in hospitals there, and using restraints, as I told you, confining to the hospitals, or that is rooms, or confining to the chains, है ना, लोहे के सांकल से उनको बांध के रखते हैं. So like that, this iron chains, etc. Whatsoever these restraints are there, they has to be made, they can be done. The patients which are withdrawn, those which are not, just like in depression we have seen, there is no activities are there, and they are in a very highly depressive mode, so they are withdrawn from all this ambience environment. So in that cases, arrange non-threatening activities. Non-threatening means if you are arranging activity, again you say that we are going for a playing game with the person, and you give some weapon, then it can be dangerous one. So make like that, that if the person, somebody is trying to engage in games or some other activity, see that nothing such thing, nothing such tool is given in the hand of the person which can be dangerous to others. It can be threatening to the others one, or even self. So that has to be checked. Encourage participation into various activities, thinkings, have sittings, provide remotivation and the socialization and group experiences, reinforce appropriate grooming and hygiene. If it was not there, appropriate grooming means development or support the patients maximum. Provide the this psychosocial rehabilitation, social skill training. So this is again part of cognitive behavioral treatment, and many psychologists, psychiatrists, with practitioner psychiatrists, they can train them in behavior, what kind of behavior they can do when such problems are there. So from such experts, they can be trained for these activities. When the patients who are very suspicious, that is very dangerous one, and be matter of fact, particularly check various activities, particularly in suicidal tendencies in case of depression. Avoid close physical contact, no touch, because they are suspicious, they can harm. I think I told you one example that there was a person, somebody, or he got a good pain, he got too much affection with the pain, and as soon as somebody prays that, he will suspect, there is a suspicion in the mind of that person that somebody will ask for the pain. And again, another thing is, if somebody asks and I will not give, then he will be unhappy, or he will have bad relations with me. And then this type of thinking, which is that way very absurd, can even go up to the thinking of killing the person. I hope you understand why it is very dangerous. If by chance he will feel that, yeah, if I kill it, that then this person, or if I harm the person, if I attack this person, then he will not ask pain from me. Means this is for small issue, these people become so violent, or the steps are like that. Okay, because they are not in a good frame of mind. So therefore, avoid close physical contact. There should be no touch, because even we know that the touch, or we call it as a tactile stimulation, can also be the one of the factor which can cause, or which can be stressor, as we have seen. So do it, be consistent in the activities, offer special food which is highly nutritious and which can be helped. Avoid whispers, because whispers are there, or special food means again see that the patient cannot be suspicious about it. Avoid whispers. If somebody is whispering, then suspicion increases. Maintain eye contact, so that patient should not feel that you are keeping eye somewhere else and you are not confident, and that means the chances of suspicion will be increasing. So these are such situations. The patients can be hyperactive in nature, so allow patient to stand for a few minutes in group. Provide a safe environment, provide activities that do not require fine motor skills, so these patients can be trained in that way. Then next is immobility in the patients, minimize circulatory problems, provide adequate diet, exercise and rest, prevent victimization. The person should not feel that the person is victimized because of the problems he or she is having. Interventions, medications, we shall be going separately for all medications. This is all supporting and we can say behavioral treatment, how to cope with the situation. For whole these various guidelines we shall be having another session. The medication compliance should be taken is very important, because it has been observed that around 40 to 60% there is a non-compliance. This word you might have heard, but I repeat, non-compliance means anything which is not followed. The drug is not properly taken, the dose is not properly taken, directions are not followed. So these are various D's are there. Okay. So drug which should have been taken, suppose some drug has to be taken at night, that is not taken. So it is drug is not taken, dose is not taken, that is one dose is skipped, directions are changed, take at morning, not taken in the morning, taken in the evening, vice versa. So these are various things which are when the directions are not followed, when anything which is related to prescription is not followed, then should be treated as a non-compliance, and that has to be taken care of, because they themselves cannot take care. Many times they are suspicious, as we have seen. So this is very tricky, how to administer medicines to these people and avoid this non-compliance. Avoid reinforcing hallucinations and delusions. So this can be avoided. Do not discuss it again and again, so that they will remember or remind it. Maintain orientation. So the orientation should be maintained. Allow them to that is how they are standing, how they are walking, how they are behaving. So they can be suggested, they can be minimum touch should be there, and whenever touch is needed at all, then it should be very judiciously. Avoid easily misinterpreted behavior, the behavior which can be easily misinterpreted. Example, we have seen whispers or not eye to eye contacts. These are various things which can result into misinterpretation or suspicions or any other such thing. So this should be avoided. Then next is reinforce the positive behaviors. Try to discuss positive things, try to be good. Avoid competitive activities, particularly where they are losing it or they will find embarrassment. Just now we have seen earlier. So this type of activities are there. Allow and encourage expression of feeling. Listen them, what they are talking about. If there is something which you can do in genuine problem, then try to help it out. So these are the activities which are there. Then particularly when you are discussing, there are some drugs which may having some adverse effect which are known, so indirectly give them hint that don't tell that this drug is causing, because again it can be suspicion and they can be overreactive to that, they may stop the drug, but indirectly give this hint, or the hint can be given indirectly that what can be done in that case. If you feel like that, if you feel like that, then you can do this like this. Clear and realistic limits. There should be consistency. Supporting environment should be there. Structure predictable. There should be reduced stimulation, which can result into the problem, which can cause the what we can say stressor like effect. Early intervention for escalating behavior, whenever the behavior is changing at every time, try to give for early intervention. Safety for the patient and other, that is even caretaker or those who are nearby, they should not even harm, and patient should not harm itself, because when depression or when that agitation or hostile movement, they can do anything, they can harm themselves, they can harm the people who are around. Those who are reading newspaper, you might have seen at many places, particularly in USA, the improper anger management and any kind of such behaviors. There are many incidences of killing that takes place. They either because their guns and many things are very freely available, no one can identify like that whether they don't need much big process for guns or like that. So somebody will buy the gun, will enter into any premises and shoot as many as possible. So these are the very dangerous situations, particularly in USA and other places it is there. So that safety for patient and other people has to be maintained. So do not give any weapon when you know about it. Opportunity for non-threatening social interactions can be there. You increase the opportunities where there cannot be any threat to patient himself, and patient cannot be a threat to others. So thus if there is increase in such social interaction, the patient may be somewhere happier, and patient can be joining, or that sense of isolation will not be there. Then remotivate the patient, resocialize the groups, and make them improve the communication skill, even own communication skill, what has to talk, what has not to be, and similarly try to improve the communication skill of these people, because many times they are talking very upset. So these are various intervention we can do. Now what family should do? Family should be involved into it. They should use appropriate community sources. The training centers can be there which can educate the family, and they can reduce the chances of relapse, and they can improve the compliance to the medicines. So these are if the family is ill, because these are supporting treatment are very important in this kind of diseases. Provide an outlet for the family, discuss feelings, explore alternative effective coping skills. These are very important for the family, so that family can do it, family can maintain it. Then next is psychotherapy. Go for individual therapy, supportive therapies. Then if possible, if it is there, example this psychiatric hospital like case, where it can be done for group psychotherapy, that is again behavioral I am speaking about, not the pharmacological. So group therapy, interpersonal skills, family problems, community support can be there. Then train the family. So give the treatment or give the training to family, expand the social network, problem solving capacity, lower the emotional over involvement of the families can be done. So these are this type of groups can be made, so that they can deal with the troubling side effects, alert the people with the potential adverse effects, minimize the isolation, increase the compliance, and thus this family can identify fears, faulty communications, then distortions, and accordingly the handling tensions and misunderstanding which are there, because these are all negative elements which are there, which can improve, which can change it. Families are not to be blamed for their schizophrenic members' illness, but they are secondary victims of the biological illness, because even though they are not, suppose somebody in their family is having this schizophrenic or psychiatric problem, then people will either keep away from them, or people will say that no, in your family one person is like that, and then they will also be suffering indirectly or directly because of these people. So these are very important things people should try to maintain. Then limited hospital stay should be done as far as possible. These are all insurance related things which are happening in USA, that is third party payments, discharge planning from the hospital, then transitional care, partial hospitalization, halfway houses, day treatment program. These are various conditions, how they are managed. If the limited stay hospital stay is there, then next is they are discharged to the transitional care before going to home or before going to other areas. So again they will be up. If you have seen somewhere, example, those patients who are in ICU or NICU, they are kept in the normal general ward for 1 or 2 days to observe. Similarly, they should be here there after discharge. They will be observed in a transitional care places. And when there is partial hospitalization or there can be halfway houses, that is in between some centers, or day treatment programs are there. There are various communities are there which are helping, like NAMI. This is one community or one big organization which is supporting the schizophrenic or mental illness patients. Okay. Then another one is a Schizophrenic Anonymous. Just like if you have read somewhere, it was in India very famous Alcohol Anonymous. That is that will be helping people to get away from alcohol, and they will be teaching about that. Similarly, this is the Schizophrenic Anonymous, and that will be helping in the patient guidances. Then schizophrenia and violences. So there are myths that schizophrenic always tend to be violent. So and mostly it may be coming from media. Media is anyway many times it is hyped when they are making the hypes of the things. So it is not there. The fact is they are more likely to be victims than perpetrators of the violence. So they are not actually initiating violence. Many times they themselves can be the victims of the violence occurs because of some of the problems. Example, maybe because of the homicidal delusions. Homicidal means they feel that somebody is coming to kill them, or they become suspicious towards the person, and that can result into violence. Or they feel that somebody is going to attack, and therefore they become such kind of thing. But if it is not, then they may not be violent, and therefore we have seen that one has to take big care about their stressors. Stressor should be minimized as far as possible. So any suspicious thing, any undue touch, undue light, undue changes should not be done. Then usually they won't be violent one. And as it has been found that many times the relatives or other people, they are violent towards them if they are not listening, they are not doing the things which were expected or suggested to be done. Then various comorbidities. Schizophrenia can be there with various comorbidities. Example, they can have hypertension, obesity, diabetes, and because of that death from cardiac diseases is higher in this patient than the normal populations. The atypical medications create weight gain. Very popular or very famous for that is olanzapine. Olanzapine causes big weight gain. It worsens the cholesterol and triglyceride levels and diabetes. So the schizophrenia treatment goes into a different mode. That is, the patient may or may not getting benefit from treatment or improvement in the schizophrenia, but definitely there is a deterioration in the cardiovascular or obesity like or diabetes like conditions, and that can be a problem. Some of them may be having habits of tobacco smoking, and because of that there can be heart diseases in these patients. Then what are the negative impacts of the severe mental illnesses? Yes, there are many that is observable and anybody can tell it. What are these? Example, there can be impairment into oral function, oral appearance, oral activities. It may be because of many facts. The most important is hallucinations. They feel that they are getting some messages, some communication from someone, maybe God, maybe devil, maybe some past king, maybe something like that. Somebody which is not seen, which cannot be, which may not be possible that it is happening, but still they will feeling like this. Then because of these hallucinations, they cannot work properly, then there can be episodes of depressions which can be dangerous, and whenever person is depressed, then cannot concentrate in work, any kind of work, whether important or not important. So because of that there is impairment, then there is a dysfunction, that is lack of work adjustment skills, social skills. So these are various skills are not there, and therefore there is a dysfunction, there is a disability, that is unemployment, homelessness, and disadvantages, that is there is a discrimination against them. There is a poverty in these people. Usually they are from these poor families. So these are actually the impacts are there which are occurring because of that. So these people are becoming more and more sufferers with all these situations, all these conditions. So if we'll see that nurse perspective into this, then patient's anxiety, loneliness is there, dependence is there, distress is there, nurse becomes more uncomfortable. There are feeling of helplessness where the anxiety is more, then there is a defensive behavior like denial, withdrawal, avoidances. Then we call it as a burnout type of effect, burnout type of activities. Peer group supervision can be helpful. Peer group supervision means the persons who are there, particularly cases we can say, suppose it is a mental hospital, then what are the peer group supervision, or what these people are having, what are the effects, what observation they are having, and then these observations can be recorded and can be used for the further assessment and the treatment. So on that basis, on the basis of observations, on the basis of the various episodes, maybe hostility, aggression, or depression episodes, and all kind of functional, there are given changes in the body languages, or how the body is behaving. Those who are having this kind of even their eyes, their lips, and all these movements, they will be very different type of this. So go for this observation, check any improvement, check about the activities, go for periodic assessment of the treatments and the goals, particularly as on the basis of prognosis. If prognosis is good, then you can continue the treatment, or if required you can reduce the doses. If it is continuous, if it is in same condition, then you can again continue the treatment, or you can modify, you can add something, and if it is getting worse, then definitely you will have to change, or you have to modify the drug. So this is how you reassess the treatment, and accordingly one can go for what new thing can be done. And then teaching about the diseases, like medication teaching and the side effect management, teaching about the disease, the cognitive social skills enhancement, identifying sign of the relapse, attention deficit in self-care. We shall see one by one. That is, teaching about the disease is important. They should be made aware that what it is, what kind of situation is there, why it is there. Particularly in country like India, people may go for this alternative people, like we can say that Ozas and Babas, and they will say that no, this is not a disease, it is something bhoot or pret or something has done, and this is happening because of this bhoot or pret. So one should be able to tell that this is not like this, it is actually disease, it is because of some neurotransmitter. Just like it can be peptic ulcer in stomach, similarly there is a problem in brain which is changing the thinking abilities. Only thing is, we do not find ulcers or person or hypertension patient or other cardiovascular or other organ disease patient as a neglected one or like that. Here also it is, if we consider brain as one of the organ, and any problem in that organ is a problem of the organ, and hence it should be considered in that way. So this kind of teaching is helping. Then medication teaching and their side effect management. So inform about all the medications which are there, what kind of medications are administration, what are the probable side effects are there, and at what point they should immediately report to the doctor. So that, example, antipsychotic agents, most of these particularly which were the older one, the typical one, they were having adverse effect of extrapyramidal symptoms. I am very sure you have gone through pharmacology very well. So they were having extrapyramidal symptoms. What is extrapyramidal symptoms? That this means the symptoms like they are similar to that of what we call it as a Parkinsonism disease. So if it is known, then we can ask them, we can say them that if this kind of things is observed, and if this is observed repeatedly or with this severity, then you can immediately report, and accordingly whatsoever medication changes or some counteracting effects has to be done or impact has to be made, that can be done. Then cognitive and social skill enhancement through various training sessions, through experts. Identifying signs of relapse. The patient was looking good, maybe patient has to be discharged from the hospital, and then showing some signs. Attention to the deficit in the self-care, social and work functioning, that has to be observed and seen that they should be how they should not reduce their own primary health and hygiene activities. So all this should be done. Exploration of community resources. What community? As I told you, there are various communities are there, which are coming, which are doing some training programs or bringing the people together and working for these people. So we call it as a community resources. We have seen NAMI or schizophrenic anonymous communities are there. These associations, these charitable societies, they work for these people and help them. Then next is signs of the potential relapse. When it can happen, when the relapse can occur, when there are feeling of tension, any stressful environment is there, difficulty in concentrating, cannot do the work properly, cannot concentrate on even normal time to time speaking. Then sleeping in the trouble, sleep is not normal, sleep is disturbed. Then increase the withdrawal, that is withdrawal from the society or withdrawal from the family, means getting more isolated, not speaking to anything. Increase bizarre or magic thinking. So these are all various activities, various situations which shows that potential relapse is there, and then again immediately it has to be brought to the doctor so that accordingly treatment has to be done. So so far what we have seen in this is what are various diagnostic criteria, at what age there is a prevalences, which gender are more common, what happens to the course of illness, what are various phases, what are various warning signs, what are various medications and their side effects, how to cope with it, then how we can manage the therapeutics well, how we can compliance, how we can make it compliance. This is everything will come. Then psychosocial rehabilitation, that is individual, group, family, all this should be involved into this, and accordingly what activities can be done, what benefits can be done. Then community resources, as I told you, various associations are there, these are helping, they are trying their best to see that these patients are getting cured. We have seen some of this like Schizophrenic Anonymous and NAMI, etc. Then stress management, the efforts should be made that stress is managed, because stressors are responsible for relapses. So it has to be seen that whether stress can be avoided in these patients. Review of antipsychotics, then go for various antipsychotic which we shall be seeing. Typical and atypical antipsychotics. So this can be type 1, type 2 and various kind of this. Then clozaril like drug which can have arrhythmias, granulocytosis, then anticholinergic agents which can affect the memories. Hypotensive drugs are there which are affecting the EPSPs, NMS. Then low potency drugs like anticholinergic symptoms are there. Check the half-life of the medication, how long it can be there. Try to reduce the number of dosing. If the half-life is lesser, then number of doses are more. Already we have seen that we have worries about their compliances. They may skip one or other time, So if number of dosings are more, then skipping chances are still more. Reduced rate of relapse should be tried, whether it is 2.5 times is there or less, accordingly it has to be checked. So antipsychotic agents are usually effective in 3 to 6 weeks. The haloperidol has low sedative property, but it has got very high this Parkinsonism like or extrapyramidal effect. It can also be used in patient with cardiac problem because it has reduced anticholinergic activity. So these are each and every drug has got its own benefits and advantages, which you might have studied in pharmacology, and we will use this knowledge for setting up various regimens into it. What can be done for the care of hallucinations and delusions? Hallucinations, check the content of hallucination, what kind of hallucination the person is having, and whether it is resulting into any kind of suicidal or homicidal thinkings. Then try to control it or try to train the patients. Then what are the attitude of the nursing staff? If they are non-judgmental, non-threatening, then it is good. Eye contact, louder voice, call the person by name, that helps because that will reduce the suspicions. Delusions, if it is there, then be empathetic, then clarify the reality to the patient's intent, clarify the misinterpretation to the environment, and there should not be argument with these patients. So if it can be done, then it will be helping the patient the most. So here we have finished the initial introductory part of schizophrenia, and this indicates what care everybody has to take in the cure or in the betterment of these schizophrenia patients. In our next one, we shall go for various drugs or various regimens for the treatment of schizophrenia. I expect you are reading the basics from pharmacology before going to the therapeutic classes. That will be helping you much. Those who will be doing it, they will be helped more. If not, it's not compulsory from my side, but definitely it is advised that if you can go do it. So take care, be careful, be watchful, and be safe.